today live or in the future through the recorded webinar. So my name is Ashley Parsons. I am the Community Health Director for small and mid-sized markets in Pennsylvania and the state of Delaware. Specifically, I work mostly in South Central PA, but I'm also working with my colleagues throughout Pennsylvania. And my background, I have my master's in public health and epidemiology, so I love data. I love anything that will further our mission to improve the health and well-being of the communities that we serve, in particular Pennsylvanians. So a little introduction to the American Heart Association. We are, I'm sure you've heard of us or seen our Heart and Torch logo. It's a pretty popular one. We are the nation's oldest and largest voluntary organization that is dedicated to fighting heart disease and stroke. And our mission at the American Heart Association and American Stroke Association is to build healthier lives free of cardiovascular disease and stroke. And we're doing this through a variety of ways, including being a nation's leader in CPR education. We stress the importance every day of healthy lifestyle choices. And we're also very proud of the education we've been able to provide to lawmakers, policymakers, and the public as we advocate for changes that protect and improve the health of our communities. And although we have been able to do a lot of wonderful work throughout the United States, we still find that heart disease is our #1 killer and stroke is our #5 killer. So we have a lot of work ahead of us. And now that I've introduced myself and the association, I would love to hear from you. Also, Maria's going to open a poll here so we can see what you all do.
At this time, we're going to ask for all those that have joined us to tell us what you do at your agency. If you are normally a pantry, you serve folks through meals, or a senior program, youth program, or other. Wow. Oh my gosh, it's lighting up, Ashley.
I see it. Can't read the percentages from here,
Not
but
yet.
we will see.
No. So take another minute to complete where you're coming from. We have many counties represented through our 27-county region. Many folks do multiple programs. So here it is. The heavy hitter is, wow, we have other types of agencies.
That's our biggest one.
It is the biggest
Great.
one for us. So maybe they have multiple pantry, soup kitchen, other community events. We have a good chunk of pantry partners joining us. And then tied. Hey, we're tied. Senior and youth programs. So thank you so much for selecting and telling us what you do at your agency.
Wonderful. Well, thank you all for sharing that. And the good news is no matter what your location does or who you work with, heart disease and stroke, well, I guess it's not great news, but heart disease and stroke impacts the communities you serve in many different ways. So moving in here to facts about heart disease on the next slide. So if you weren't already aware, heart disease, #1 cause of death in the United States. It's also the #1 cause of death in South Central Pennsylvania. I haven't had the chance to look into North Central Pennsylvania statistics, but I would be hard-pressed to know that it would be any different than the rest of the state in terms of heart disease. We see it's most common in individuals 65 and older, but it is a problem throughout all age brackets. It's actually the #1 cause of death for women over 25. And we are moving into Heart Month, so a quick plug here. February 2nd is Wear Red Day, so I encourage you all to wear red, promote our mission, promote our messaging, and also share with a loved one the importance of regular heart checks and speaking with their doctor about any risk factors. And although heart disease is the #1 cause of death, most people don't know that they're at risk. And the truth is, heart disease is pretty preventable. About 80% of heart disease can be prevented. And in most cases, prevention, it focuses around healthy choices. These healthy choices include not smoking, avoiding secondhand smoke, treating high blood pressure, knowing that you have high blood pressure and seeking treatment, eating a diet that's low in saturated fat, trans fat, and sodium, And having physical activity for adults, that's about 150 minutes of moderate physical activity each week. Maintaining a healthy weight is very important. Controlling blood sugar, controlling cholesterol, seeking medical advice, having regular checkups, and also taking medicines as they are prescribed. And specific to Pennsylvania, in 2016, we saw just under 32,000 deaths that were attributed to heart disease. So this is a huge issue here in Pennsylvania and across the United States. Moving into stroke, stroke is our #1 cause of debilitating disease, and it's the 5th leading cause of death worldwide. And so if you're not familiar with what a stroke is, to sum it up, quick terms here, stroke is when blood flow is interrupted to the brain, and we need blood flow to the brain to bring oxygen to the cells. So when that is disrupted, we see brain cells die. And although immediate treatment can save lives and can also reduce the long-term effects of a stroke, more than 1/3 of acute stroke patients don't call 911 and go to the hospital. And so it's very important to the American Heart and Stroke Association that we continue to educate around the symptoms of a stroke, and you'll see along the right-hand side here where we have our acronym. So it's really easy to remember. It's FAST. So F stands for face drooping, A stands for arm weakness, S stands for speech difficulty, and when any of these are noted, it is time to call 911. So the American Heart Association has some really aggressive goals, and these goals are a great opportunity for us to partner together to improve the health and well-being of Pennsylvanians. And so by 2020, we are really striving to have an improvement in cardiovascular disease by 20%. So we want to increase the health of Americans by 20% while also reducing the deaths from cardiovascular disease and stroke by 20%. Now you'll see here at the top, we've only had about 4% progress towards improving cardiovascular health, and our biggest setbacks have been around unfavorable changes in body mass index, also unfavorable outcomes in physical activity and diet, and these were similar for both adults and children. For reducing death, we have about a 14% improvement towards our goal. Now that is somewhat on trend, but unfortunately for the first time in decades, and actually the first time since the American Heart Association was created, we're seeing an uptick in stroke and heart disease deaths. And there are many reasons this could be happening, one of which is we can attribute to possible unhealthy lifestyle choices. So a great time for intervention. And we believe that our greatest opportunity for success in achieving these 2020 impact goals in the next 2 years is going to rely on reducing the number of adults who smoke, reducing the number of adults with poor cholesterol, and reducing the number of adults with poor blood pressure. And when we think about children, our focus is going to be on smoking, healthy diet, and physical activity. And so we realized that in order to achieve these goals, we need to think about things a little bit differently. So the American Heart Association has done a wonderful job of funding scientific research. We've also done a really great job at advocating at the state and local level as well as the federal level. But what we are needing to improve is how we're building a culture of health in our communities and how we're working with existing organizations such as all of you on the call today who can help us build healthy families, cultivate healthier workplaces, engage with our cause, increase physical activity, and improve care and response. And so in simplest terms, building a culture of health is one in which the healthy choice is the easy choice and it's the preferred choice. But we also understand that we need to ensure the opportunity of health for everyone, regardless of where they live, work, play, or pray. And so we know that just telling people to eat better or exercise may not significantly improve their behaviors over time, most likely because they may not have access to resources, neighborhoods, or environments that help to support those decisions. They also may not know how to get started. And so by addressing the environment around us, we are part of a movement to make the healthy choice the easy choice, like I had said. One of the examples of how we're doing this is working in places where clean indoor air is not possible. So that's why we are advocating for a Clean Indoor Air Act that is comprehensive in Pennsylvania. I'm sure many of you have attended a location that is one of our exempt locations in Pennsylvania where smoke-free air is still possible. And so, smoke-filled air is still a possibility. And so we're working to change that, thinking about the people who work there or frequent those locations, how to change those built environments. We also know that there are complex issues that go deep into communities' infrastructure, and so we're looking for ways to engage our community partners, again, like yourselves, to collaborate to address issues that are impacting our community's heart health. And so everything that I've mentioned here builds off of social determinants of health. So if you're not familiar with what social determinants of health are, they are the factors that go into your life or your client's life that are not clinical care, though clinical care can also be a social determinant of health when we think about access to care. So thinking about poor education outcomes, lower wage earnings, access to care, depression, hunger, violence, time lost from work, poor housing options, all of these go into an individual's heart and brain health. And so one of the ways the American Heart Association is looking to improve the social determinants of health is advocating for better health care. We're also working with community groups throughout the country, and these are important because we know about 19 million Americans live in unstable housing situations. We know that housing and food insecurity lead to adverse health outcomes. We know that health isn't just about your behavior, it's about the places where you live, where you work, where you learn, play, and pray. You'll hear that a few more times from me, and that we know these are complex social factors within these locations. We're committed to ensuring that our workforce and workplace and mission impacts America's diverse populations. And one of the ways that we're addressing these issues is that we're including things that traditionally haven't been a part of the health conversation. So talking with our sponsors and our healthcare partners about economic stability, about education, about neighborhood, and about societal influences. So I believe we have a poll here. So we are looking to better understand the clients that you serve and understand the barriers that you believe are the biggest barriers for those clients to live a healthy life so that we can better improve our outreach and also provide you with the best resources.
And here it comes.
We'll give you a minute or so to answer that.
Right. Folks are engaging, selecting their choices, and it is a very complex issue, as you've said. So we just want to hear from you, your thoughts on barriers to living a healthy life.
And we have a chat box function, correct? So if other is not encompassing enough, or if there's something we've missed on the list here, please feel free to comment, and I'd love to have a discussion about that.
Give folks about another 30 seconds to complete the little poll. And if you want to, as Ashley mentioned, send in your own as an other box through the chat box, and we will address those issues. Okay. Folks seem to have completed answering their response, and highest on the list, not having adequate resources.
Mm-hmm.
Next, facing larger challenges in their life, followed by knowledge gap, what is healthy, and rounding out the time, not access to health care, not enough access.
Wonderful. So I'm glad to see that you were also engaged with this poll, and I understand the concerns of your clients definitely in facing larger challenges. That's something that we run into a lot. I'll be talking briefly about some of the programs we offer, and a lot of what we're hearing is that although people know they have high blood pressure, they know they're not living a healthy life, they have other things happening in their life. They don't have access to food, they don't have a safe housing, they don't have a job. There's so many other factors going on that their health really takes a back burner. And so we're really looking for strategies on how we can work with you all, knowing your clients best and the populations that you serve, so that we can help to mitigate some of these factors. And so achieving a healthy community here, is there a comment as well?
Yes, we have a comment. Thank you, Hannah, for sending in your comment. She feels many folks are unconcerned about it.
Okay. Yeah, so prioritizing people's health, that seems to be a concern or a problem, a factor in a lot of what we do. So helping to convince individuals that their health really is important. And so a lot of that's going to go back to education and some of the resources that we're able to provide, and helping to educate all of you so that you can be great stewards and help those individuals. We know that being healthy leads to a lot of wonderful outcomes in your life, that people are more likely to have stable employment when their health is not a concern, and it has a trickle-down impact. And so achieving healthy communities, now that's no easy task, and I'm sorry to say that there is no silver bullet. There's no single policy, program, or organization that has all the answers, ourselves included. Rather, everyone has a role to play, and everyone has something to gain from building a healthier community. One strategy the American Heart Association is undergoing to turn our communities into healthy communities is utilizing the fundamentals of collective impact. So collective impact is an effort to bring together multiple stakeholders from different sectors working towards shared measurable outcomes. So in this case, it would be all of us working together, not only on food insecurity issues, but also on health issues. So we all have a different piece that we are experts on that we can bring to the table. And so the AHA is going to continue to do collective impact in our local communities to help make those connections happen. And I invite each of you and your respective organizations to partner with us as we make these changes a reality. So some of the ways that we're going to be able to work together in its simplest form, I'd like to offer you the resources, free resources that we have on our website. So you'll find at heart.org, and we'll flip over so you can see what that looks like here. So heart.org is an ever-changing website. We try to keep it as fresh and relevant as possible. So when you are on the main page, you'll see Healthy Living as a tab here up at the top, and that's going to redirect you to one of our national campaigns called Healthy for Good. So with Healthy for Good, you're going to see here in the colored boxes, Eat Smart, Add Color, Move More, and Be Well, are going to lead you to a wealth of resources. So videos, infographics, toolkits, recipes are a very popular one. And our recipe webpage, I will say, has a variety of sort features. So you can provide recipes that are very advanced, or you can provide some easy, healthy recipes to your clients, or potentially this is something you may want to pursue in some of your locations that serve food. There's going to be articles on here, infographics, so a great wealth of information. Again, these are all free for you to utilize. You can print these, you can utilize them however you'd like. We do have suggestions. We have toolkits available on some of our Healthy for Good campaigns, also our Eat Smart month, which happened in November, but can be done throughout the year. So you'll find this information on our website.
We'll definitely send all the follow-up links.
Yes, we will share follow-up links, and you will find that a lot of what we do focuses on what we call Life Simple 7. So Life Simple 7 are 7 tips that we encourage that, it doesn't have its own slide, but we can, it's all right. So Life Simple 7 focuses on quitting smoking if you are a smoker, eating better, being active, losing weight if necessary, managing your blood pressure, controlling your cholesterol, and decreasing blood sugar. So you'll see a variety of resources around those. We also have information on how to manage stress and how to make physical activity a part of your daily life. And so Life Simple 7 is really going to be achieved through nutrition by eating more fruits and vegetables, whole grains, low-fat dairy, nuts and legumes, and lean meats, while eating less of saturated and trans fats, sodium or salt, sweets, sugary drinks, and fatty red meats. Another way that we're going to reach our 2020 impact goals is going to be by helping Americans, and Pennsylvanians specifically, control high blood pressure. But the only way that we can help them control their high blood pressure is if individuals know that their blood pressure is too high. So you will see here on this slide our rainbow chart. This is a new chart. If you've been to your doctor in the last year or so, you may have thought 120/80 is perfect blood pressure. Unfortunately, through our science, we're finding that individuals with a top number, which is the systolic number, between 130 and 139, or that bottom number, which we used to think 80 was healthy, between 80 and 89 actually does fall into high blood pressure or hypertension stage 1. So we know that about 14% more Americans are going to have high blood pressure, which leads us to right about half of the U.S. adult population has hypertension. Now that's a huge problem because hypertension leads to stroke, it leads to vision loss, heart failure, heart attack, and many other complications. Blood pressure is also something that can be controlled through lifestyle changes and medical intervention. Though when we did change our guidelines to have a more conservative estimate of what is healthy blood pressure, it was not our intention that individuals seek medical intervention in terms of medication as the first line of treatment. We really do want to encourage individuals to make lifestyle changes. We know that lifestyle changes will have the greatest impact on lowering blood pressure, specifically in terms of nutrition, physical activity, and weight loss, and also avoiding alcohol and not smoking. So we want people to feel the urgency of what hypertension is while also having opportunities to change their lives. One of the ways that we're doing this is a program I mentioned very briefly early on, and this is through our Check Change Control program. Now, Check Change Control is a completely free resource. It is a volunteer-led program, and it can be implemented in a variety of sites. So we have been successful in implementing in community sites such as YMCAs, churches, other community groups, and it is a 4-month high blood pressure management program, and it can be as involved or as hands-off as our partner organizations would like it to be. We will, as the American Heart Association, provide training for any organizations who want to pursue this. So it's a train the trainer approach. We'll give you a toolkit and all of the resources that you need to implement a program, and we'll also make suggestions around other partners in your local communities that you can work with to make this program a reality. And this program focuses on 3 major pillars, and that's that checking high blood pressure is very important. So identifying individuals who have high blood pressure, helping them prioritize their health once they acknowledge that they have a reason to care about their health. Then we encourage them to change their lifestyle and seek treatment, and also control hypertension by taking preventative measures such as physical activity and nutrition. Another wonderful resource that we have, which may or may not be available in all locations, but we're happy to connect the dots if this is a struggle. We are the leader in CPR education in the United States, and we offer hands-only CPR training, either through our organization or through our affiliated training centers. And so we're reaching millions of lifesavers in the community, not only through CPR kiosks and CPR in schools programs, but also through hands-only CPR events. If this is something you'd be interested in hosting at your location, please feel free to reach out to me and I can connect you to the adequate resources you'll need. With hands-only CPR, there is no certification. There are some kits that we may be able to share with your locations if it's something you are interested in. Great, and then we have 2 final poll questions here that Maria will open up. One is, which AHA materials are you most interested in utilizing? And then the second will be, are you interested, there's 3. Are you interested in pursuing health activities at your location? And if so, which types of health activities are you interested in pursuing? And the intent of these questions is so that the American Heart Association can better tailor our outreach efforts to our partners through your responses. So we will open up those polls now.
Okay. And those questions are going to be combined
Yep.
in part of an evaluation of the session. So they're going to
Mhm.
pop up after we actually close the session.
Wonderful.
So maybe any other materials, like we are able to provide folks with links to the website.
Mm-hmm.
We are able to provide PDF documents, any of those things to download. Any other ways, any other materials that we can provide to agencies? What would those be?
Yeah, so I will definitely look into all of the links that we have. Our campaign, such as Healthy for Good, is going to provide you some really great resources. Like I said, with February being Heart Month, we are developing, and it's cutting it a little close, but our National Center is developing some resources around our messaging for Heart Month. So we'll have some toolkits that you can utilize and adopt, either if you would like your worksite to have a Wear Red Day, or if you want to devote a specific day where you can push out materials to your clients, we strongly encourage that. So I'll be looking forward to those toolkits as those come out, and I'll be happy to share those.
Okay, and we can also send those out and post those on our website.
Wonderful.
That would be good. And then kind of describe what's going to be involved in the last two parts here.
Yeah. Okay. And so when we talk about, so when you see the question on materials, it's going to be around nutrition, physical activity, warning signs, blood pressure, and then also the opportunity for other. And then when we're talking about health activities, some of the options you'll have are around things we want to understand your interest in are health screenings, promoting healthy options, potentially looking into the opportunity to build a toolkit for our partner organizations so that they can help make the healthy choice the easy choice for their clients. We've provided cooking demonstrations in other locations, and then if there's another, please feel free to either forward those comments to Maria or myself. You'll see my contact information on the last slide here, and I'd be happy to discuss other options with you further.
Perfect. Excellent. So folks can think about that. Before we end the session, we're going to open up for any questions or comments. Please send them via the chat box, and we'll be more than happy to respond. If you would like to actually ask your question live, please raise your hand, and then we can unmute you to hear your voice. We'd love to hear from our partners. My gosh, we have some good friends on the line, so please take a moment to send us any questions, any comments about today's webinar, and if you would like to ask the question live, please raise your hand. All right, take a couple moments. Quiet group, come on. Or do I need to single folks out that I know?
She'll do it.
Oh, we have a hand. Oh, right. They knew. Let's see. All right. Sarah Kemp from Manna Food Pantry, I'm going to unmute you so you can ask your question. Go ahead, Sarah.
Well, it's not so much a question as information. We already have a Penn State medical team coming up maybe once or twice a month on a Thursday night when we have Manna, and they administer blood pressure screenings and a couple different things with the clients if they want them. And it's been very successful. So I don't know if having the American Heart Association come in too would be like double dipping. I don't know.
Yeah, I'm really glad that you brought that up. So for all of our partners who are on the phone today who are working with Penn State Health, I have had that same thought. It wouldn't be beneficial for us to double dip. So what we are doing is I'm working with Penn State Health to provide them materials. I know each month they have a different health topic. So they're very interested in partnering on those health topics that touch heart and brain health. So we'll be partnering together. So I will be providing materials to Judy Dillon's team at Penn State Health that they will be utilizing in those partner pantries. And so
Oh,
great comment. Thank you for bringing that up. We're also looking to work with more pantries, get more information so that we may be able to roll out a statewide toolkit that any pantry could use, so that if they don't have Penn State Health or another health organization that they're working with already, that we may provide resources and ideas of how they could pursue those types of activities.
Perfect.
Okay, thank you.
Thank you.
Thanks, Sarah. Thanks for all your work.
Thank you.
All right. Anyone else with a question or a comment? We'd love to hear your voice live. So please raise your hand. We did have a comment asking about the PowerPoint being available, and absolutely. We'll send that in a follow-up email. And yes, actually, you're also going to get this lovely session recording as well. So all of those folks will get all of that information afterwards.
Wonderful.
All right. Any last minute? You did well. You did well.
Thanks.
Holy crow.
Hopefully I didn't breeze through too far. Large organization. We have a ton of resources. I'm mostly focused on our nutrition and blood pressure resources, but we have a lot in regards to clinical care. We're also working with our federally qualified health centers, which you may or may not already be partnering with. And so we'll be looking at a more statewide approach of how we can work with those federally qualified health centers to not only share the resources that they have, but also improve the resources they have in regards to heart and brain health.
Fantastic. Well, Ashley, we thank you for your time.
Thank you.
We thank you. We love the American Heart Association, and we're so excited to partner with you and what more we can provide for our partner agencies. Thanks for all those folks that are joining us for this session. Thanks for all that you do in your communities. Before we end, as we mentioned, we'll be sending the follow-up presentation. You'll get the webinar recording along with any links and resources that you may need. I do strongly encourage you to take a few moments as the session ends. An evaluation will pop up with those polling questions that Ashley talked about. Which materials are you interested in at your agency? And if you are not already partnering with a health organization, what kind of health activities would you like at your location? So please take a few moments to do that. Your feedback is very important to us for this session and for future webinars. So here we go. Anything else? Any last
we're
words,
great.
Ashley?
Thank you all so much for being on the call today, for all the work that you do. Echoing what Maria said, we know as the American Heart Association we can't solve all of the social determinants of health, but working with groups like you all who are really the boots on the ground to make those changes, we're very appreciative for your partnership.
Thank you.
Thank
you.
you.
Everyone have a great day. Bye-bye.